I got the opportunity to work with Child Family Health International, and the challenge here was to work with a group of all male medical directors of all the programs in India. So this was a very challenging issue, even at the time of the interview, and the challenge was who would be able to coordinate with 5 high-powered, high-profile men who are much more qualified than I am, who are much more, professionally placed than I am. So the challenge was to deal with them. So when I came to CFHI at this level, I chose not to change my style of working, but to use the same collaborative method of working. And I think I was able to do justice to this, and I was able to deal with these men quite reasonably well. So at CFHI, one of my important responsibilities is to maintain the quality of the program. So sometimes I have to be very straightforward in conveying the message to these medical directors, but I still use the collaborative method. So it requires some sophistication to be direct, but I don't impose, So to give you an example, one of the doctors who was new to the program, and he had served all through his life as the head of reputed government hospital, as the head of the hospital, and so dealing with him was a big challenge. And he came from a very successful, he was very, very successful in his life, and also he came from a government setting, so where he used to be very dictating in his terms. And I remember when I and Steve actually first met him and saw him, we were not sure if he'll be able to work with our students. So, but I was able to mold him to a great extent to the style of the CFHI program by being direct with him, and also, by inviting him to the discussions and giving suggestions, and, so I think he was able to, he was then comfortable, and it allowed, my style of working allowed him to incorporate his ideas to the program, so that he felt that this was his program also.